Hello, everyone. Welcome to our new podcast episode, this time online. And this is the first podcast in English. With us is Mario Atzemis from Greece, Athens. Mario, Kalispera, and how are you, first of
Καλησπέρα.
all? Thanks for accepting the invitation for podcast. It will be a lot of interesting topics that we're gonna do for everyone who see this podcast that will be go on. Can you tell us something about you?
First of all, I have to thank you for inviting me here. I am a harm reductionist. I have a lived experience in problematic drug use, and I worked a lot of years in the front line of harm reduction. Also, I evolved to a drug policy expert, and currently I work for the city of Athens and as a deputy chair of addiction for prevention for addiction centers. And I am one of the people who designed and implemented the Athens action plan about drugs.
We're gonna talk about drugs and addictions. As you mentioned, you're a former addictioner. And when we talk about drugs and addictions, what can you tell me about what do people get wrong about addiction? What are our prejudgments about drug users? Can you share your experience?
In my work, yes. First of all, I would say that there is not a simple answer to such a complex issue as addiction. And what I meet, and in my personal life and in my work field, is that one of the biggest misconceptions is that addiction is a kind of a moral fail, a lack of willpower, or simply the result of making poor choices. This is both scientifically inaccurate and socially very harmful. Addiction is a very complex biopsychosocial phenomenon. Biology matters, psychological vulnerability matters, trauma, poverty, social exclusion, family relationships, mental health, housing, the environment in which someone lives, and of course the characteristics and the availability of each given substance. And there is another important distinction. Drug use is not the same with addiction. Most people who use psychoactive substances do not necessarily develop a substance use disorder. If we confuse any drug use with addiction, we cannot understand either the phenomenon properly. And I would actually say that addiction is not a failure of character. It is a complex interaction between a person, a substance, and the social, economic, and cultural environment. That's all.
Great. I agree with that. And well, the next question is logical. Why people start to use drug? Is there any, you mentioned some trauma.
People start using for countless reasons. It's pleasure, it's experimenting, socialization, sexuality, but also coping with emotional pain, trauma, loneliness, belonging to a group. There are many different factors. But the most interesting question regarding to that is not why do people use drugs, but why do certain people develop problematic patterns of use while others they do not. And that takes us back again to vulnerability, to trauma, to mental health, to socioeconomic conditions, social support, and the environment. We should also never forget something very basic. People use drugs because drugs can produce effects that people find pleasurable, useful, or relieving. If a drug policy refuses to acknowledge this, it starts from a false premise.
Can drug use ever be separated from social inequality? I mean, you mentioned that when people who are use drugs are in general, uh, let's say, qualified as bad humans, or they're not deserved to live, or they're criminals, treated like that, and have to change that, let's say, point of view who use drugs, and have to be more supportive and inclusive to those people who use drugs.
Look, first of all, there is always will be social groups that stigmatize other social groups. Okay, this is a general phenomenon. What you're actually asking me is addiction now, is problematic drug use a disease or an individual problem or a social problem? You know, it's a complex thing what you just asked. First of all, the disease model has been extremely important because it challenged the idea that addiction is simply immoral behavior. But if we understand addiction exclusively as a brain disease, we risk ignoring the social environment in which it develops. And the biopsychosocial model is much more useful because addiction has biological and physiological dimensions, but it is also profoundly influenced by social conditions, and this is matters politically. Now, about the drug users is a very, drug use is a very wide phenomenon, and we have to distinguish between people who go to a club on a Saturday night and doing some recreational psychoactive substances and the problematic drug use. But above all, against the stigma and discrimination is when we support the scientific basis of the idea that drug use is a public health issue and it's not for punitive measures. I don't know if I covered your question.
No, it's okay. I mean, you correct answer. I mean, there's no correct answer. Just we are just talking, and it's dialogue between me and you who are in that topics. The next topic is harm reduction. Can you describe what is it in some simple terms? And often we saw that the question like, is this controversial or not? And
Yes, there are many formal definitions about harm reduction, like a set of strategies that they're trying to minimize the harmful effects of drug use. But after so many years working in the field, I see harm reduction as something really broader. It's like a state of mind, and in many ways, a way of life. We begin by accepting people as they actually are, meeting people where they are at, not where we would like them to be. It means also that healthcare and human dignity should not be conditional on total abstinence. Harm reduction is grounded in public health, human rights, evidence, and pragmatism. But there is another fundamental principle: nothing about us without us. People who use drugs must participate meaningfully in designing, implementing, and evaluating the policies and services that directly affect their lives. And harm reduction, another misconception is that harm reduction does not oppose recovery or abstinence or prevention. If somebody wants abstinence, we should support them. But abstinence cannot be the price always that somebody has to pay to receive healthcare, housing, dignity, or protection from health hazards, or protection from death. And about the controversial issue is, drug policy historically has been shaped by morality and punishment. There is a still belief that making drug use safer, somehow you encourage drug use. We have shared this argument about needle and syringe problems, about opiate agonistic treatment, even about naloxone and drug consumption rules. But, as harm reductionists, we ask a different question. It's not a question, do we approve of this person's behavior? It's a question, what can we do today to keep this person alive and healthier? And, there is no treatment or therapy that for someone who is dead. And sometimes the controversy is ideological. In Greece, this controversy is ideological rather than scientific. The social sphere, the public space, and the dialogue about drug use is been based on ideological, hallucinations and obsolete schemes of the past. Evidence can tell us whether an intervention reduces HIV transmission or overdose mortality. Moral discomfort is a different question.
Wow, that's when we talk about drug. Also, I forgot to ask you, is there who use more drugs? Is that peers who are in some period of adolescence, or what was the kind of group that use drugs? Is there any differences between ages, or do you have any kind of statistic or
Yes,
that you
yes, yes.
know?
First of all, we have European statistics. What we see is that the stimulants are on the rise for younger people, and we also see that the opioid users, as a population, they declining and they get older. We also know that stimulants are being very, very widely accessible, and we have record numbers of accessibility in the younger population and record numbers of pricing, lower pricing. In Athens, to be more specific, there was not other time for cocaine or crystal meth, and also for heroin to be cheaper than this time. So yes, we have this kind of statistics. We know also about the coming of new psychoactive substances, etc., etc.
In your work with users, with them, what's the, let's say, hardest thing for them? Is it that to say that, okay, I'm drug user, I need to overcome that, I need help? What is the most, let's say, difficulties for them, or some challenges that are deal with?
Look, first of all, as we said and before, while we talked before the podcast, I don't currently work in the field, but from my 10 years experience, the problems actually is accessibility to healthcare units and to life-saving services. And another problem is the internalized stigma and the systemic stigma. All these things are working together, discouraging people approaching life-saving services for them. Also, for many, many decades in Greece, we had in a part of the treatment of the therapy for people who use drugs, we have obsolete practices and that were humiliating and they're torturing people in order, as they said, to get clean. There was, there was a treatment culture in which humiliation, confrontation, punishment, and psychological pressure were sometimes presented as therapy. People were told that they needed to be broken down before they could be rebuilt. In some cases, practices that I would describe as degrading or abusive were justified in the name of, quote unquote, recovery. For me, that was a major factor for discouraging people to approach services, and it's one of the darkest legacies of addiction treatment in Greece and globally. Shame is not therapy, humiliation is not treatment, and suffering is not evidence that a program is working. We also have to acknowledge the consequences. When people were expelled from treatment, they were traumatized further, or they made to feel that relapse represents personal failure. Some returned to drug use, and even in a more vulnerable position, and in the context of reduced tolerance after abstinence, relapse can also carry a very real risk of fatal overdose. This is why modern addiction care must be evidence-based, trauma-informed, and grounded in human dignity. Treatment should empower people, not control them. Build therapeutic relationships, not obedience, and recognize relapse as something that may occur in the course of recovery than as a moral failure deserving punishment. Personally, I had this experience going to this tough love rehab community for 1 year. It was a horrible experience. And also, the following years, I went to a proper treatment that they used psychotherapy and art groups. And I saw the major difference between them. We should encourage people not to be afraid to ask for help, not to be afraid to be humiliated. Shame is not therapy, and humiliation is not treatment.
What should every country, for example, should provide to people who use drugs? We talked about it before our podcast. So, do you have any ideas what should be provided by laws or?
As we said before, like the drug use is a public health issue. So in that regard, I would expect the minimum of needle and syringe programs, opioid agonistic treatment, HIV and hepatitis testing and treatment, naloxone, outreach, street work, period services, overdose prevention, sexual health services, low threshold healthcare, and where appropriate, drug consumption rooms and drug checking. But services, services alone are insufficient. As we said before, they must be accessible, adequately funded, geographically available, and free from stigma. And peers, people with a lived experience of drug use, should not simply be invited into a room after everything has already been decided. They should participate in decision making from the beginning.
I mentioned country in that questions. What do you think about how much is important to country have a role in that? Let's say what should provide, and do you think our countries or government or I don't know are interested into working and helping to make some programs for addictioners? Is there any interesting of country to take care of it, let's say?
I think that the central government and the city government, where I am part of it, are fully aware of what is going on. There are many things that they should be done, but there are many also steps that we already have made towards that. You know, for the first time historically, Athens has an action plan for drugs uh, with the same standards as the European action plans and strategies about drugs. That was a huge step to implement policies and to reestablish services that are addressing, you know, drug use issues. I am sure that everyone knows what we have to do.
Okay. We're gonna talk also about decriminalization and legalization. And can you tell us to me and my public what's the difference between that terms? And I mean, it's often in media like what means decriminalization, and they also said that legalization is a bad thing. I don't think it's a bad thing, but if you can explain to public what's the differences and what's good or what's bad and what should be implemented into laws.
Thanks for this question. Is a good one. You know, usually the media use that terms in order to raise moral panic and to sell more fear and to sell more, you know, stories that are going to become popular and to raise also mass hysteria. You know, decriminalization versus legalization, you know, these two terms are constantly confused. Decriminalization means that possession of use of drugs for personal use is no longer treated as a criminal offense. It does not necessarily mean that the production and the supply become legal. Legalization, or in better terms, legal regulation, goes further. The state creates a legal framework governing production, distribution, sale, or possession. So you can decriminalize the person who uses drugs without creating a legal commercial market. For me, the fundamental argument for decriminalization is straightforward. People should not acquire a criminal record because simply they use a psychoactive substance.
Mental health is one of the important things, and this is the most topic I like to talk and discuss about it, and how close are connected with mental health and addiction.
In this subject, I think we have to be very careful
Yes,
how,
agree.
yeah, how we see things, how we express things. You know, we have to be very careful connecting the addiction and the mental health. The relationship, as far as I know and I've read, is extremely complex and goes in both directions. You know, people may use substances to cope with anxiety, with depression, with trauma, or other psychological distress. Substance use can also, in some cases, worsen existing mental health difficulties or contribute to new ones. The mistake is trying to decide which problem came first and then treating only that one. You know, we need to treat the person, not the administrative categories. And we need to listen to the person, not to categorize the person to a disorder and then treat him. But above all, someone should not be rejected by mental health services because it uses drugs, or rejected by addiction services because they have significant psychiatric needs.
And you mentioned that psychotherapy or some kind of therapy that are work with drug users, and what is the role and the importance of support professions like psychotherapists, psychologists, social workers, psychiatrists? What's the role of them, and why is that important to have that support professions who can help people with problems, not just drug users? There's a lot of problems, but why is important to have that professions?
I'll tell you, first of all, psychotherapy changed my life. May sound as a cliche, as someone says as a slogan, but it's actually true. And this is particularly important what you asked in addiction treatment. As I mentioned before, historically some approaches were based on confrontation, humiliation, the so-called tough love, which in our country was imposed from the so-called Center for Treating Addicted Individuals, KFA. I consider many of these practices deeply problematic. Treatment should not break somebody down in order to rebuild them. Psychotherapy, thus, in my view, can be enormously important because it allows someone to understand not simply how to stop using or whatever, but what function substances had in their life and how they can construct a life which they no longer need that function. Social workers, psychologists, nurses, outreach workers, peer workers, and other frontline professionals often provide something that institutions usually underestimate: a human relationship, a connection. People like me and like many, many others who have experienced years of stigma and rejection, may initially distrust institutions, services, programs. Sometimes the first intervention in that it's not medical. It's that someone says to you, I listen to you, I see you, I get what you're talking about, and you still have choices. I will never forget the very first moment when I heard that in my treatment years. You still have choices.
Yeah, this is the most important, like that there's no like you have to heal for 1 month. No, it's a big process. There's a lot of things, as you mentioned, to understand what is problem. People often forget that close friends and also family are very important, because if you don't have that connections or prejudgments, there's no like there cannot be let's say
Exactly.
successful healing or
Yeah,
whatever.
I
And
call that the supportive network.
human rights are people who use drugs more treated like criminals, patients, people who have problem, or I don't know, the crazy guys who don't know what to do with their lives. What's the how
Yes,
often
yes.
society see the people who use drugs?
Usually, as you said, as criminals, and also they are not treated as humans. They are treated as something inferior, potentially dangerous, but inferior. Even, with the healthcare system, stigma remains extremely powerful. People who use drugs may be considered unreliable, manipulative, responsible for their own illness, on their own choices, or whatever. Human rights, do not depend on whether society or the public opinion or what is that as a public opinion. Human rights do not depend on whether society approves someone's behavior. You don't lose your human rights because you use drugs. And the human rights of people who use drugs are constantly being violated. And I have to mention here that the right to health care services is a central one. The right to dignity, to privacy, to bodily autonomy, to freedom from cruel, inhumane, or degrading treatment. The right to equal access to healthcare, to housing, protection from discrimination, and in some cases, even the right to life, when evidence-based intervention capable of preventing deaths are deliberately unavailable. We are struggling in Athens to make, along with the city of Athens and vital strategies, to make naloxone available to everyone, because we have record numbers of overdose deaths. And we are running, as I said, a project with the vital strategies. Athens is part of the Partnership for Healthy Cities, and we're struggling for overdose prevention to save lives. And I have to say something here, excuse me. All these violations, even the right to life, the right to live, have been very intensified by criminalization, particularly for people who already experience marginalization.
Yes. And should people who use drugs have a voice in managing drug policies or changing some policies? I think it's very important to hear their voices, because I think they can make some improvement into better drug policies or better. We talk about health care, and I think it's important to have their voices, to hear what they think and what can then improve and what they wish to be better. Let's say like this.
I wouldn't say only a voice. I would say, meaningful participation and actual influence. We would consider it unacceptable to develop HIV policy, where I come from at least, without the people living with HIV, or disability policies without people with disabilities. Drug policy should be no different. And lived experience, it's not a substitute for a scientific evidence. It's another form of knowledge that should interact with scientific evidence. And this is something I would emphasize strongly.
And how can we protect the public health without violating or go into individuals' freedom? What's the best way to
Yes,
uh, what's the best way to do it?
I don't think that these objectives are opposed. Good public health policy protects both the community and the individual. Harm reduction is an excellent example. Providing a sterile injecting equipment protects the individual from bloodborne infections, let's say HIV and hepatitis. But it also reduces transmission in the wider community. Naloxone saves an individual life, but preventing overdose mortality, it's also a public health objective. So the real question is not public health or versus individual freedom, but how do we design evidence-based policies that protect both? And usually coercion should be the last instrument, not the first. I would like to thank you again for this, opportunity. And, for me, it's a pleasure seeing young people like you going deep into these subjects. Because, usually these subjects are not widely discussed, first of all. And when they are discussed in the mass media and in the social media, usually they are discussed in a sense of a moral panic, which is not, the case. It's nice to take things and put them on the ground of human rights, of harm reduction, of public health, and a life with dignity and respect for everybody.
Okay, that's it. I would like to thank you. I'm very grateful that we talked today and that you accept my invitation to talk about topics that I like and that I'm deep into, and trying to, when I always have a chance to goes public to talk about it. So thank you very much, and I hope you
You're mostly
joined,
welcome.
and that's it.
Okay, guys, see you again.